Hello everyone, I am Dr. Vikas Singhal, Senior Consultant, Department of GI and Bariatric Surgery at Medanta Hospital in Gurgaon. So gastric sleeve surgery is one of the most commonly done bariatric surgeries worldwide. What we have to understand here is that obesity has become a very common problem across the world. It is a pandemic, and for patients who are over say 25 to 30 kg in excess weight, above their ideal weight, it's very difficult to lose weight with the help of just diet and exercise or medicines. That is where bariatric surgery comes in, and especially sleeve gastrectomy or gastric sleeve surgery is one of the most commonly done bariatric surgeries. So the gastric sleeve surgery is relatively fast, short duration. It typically takes about 1 to 2 hours for most patients. Of course, sometimes we may have super obese patients, but for the most patients, the surgery is relatively fast. It takes about 1 to 2 hours. So yes, I would say all bariatric surgeries are major surgeries because they are under general anesthesia. Of course, the surgery is very standardized. The patient undergoes a thorough preoperative checkup, including cardiac, lung tests, all the whole body evaluation is done. Once the safety for surgery is established, our anesthetists do a detailed evaluation, and then we take up the patient for surgery. But yes, although it is done laparoscopically, almost always laparoscopically, minimally invasive with small cuts, but yes, it would still be classified as a major surgery. So patients who have been struggling with obesity or diabetes, obesity related medical problems, let's say they are about 30 kg excess weight, they should be 60 kg but they weigh 90 kg, or if they're about even 20 kg excess weight but they have weight related medical problems, metabolic problems such as diabetes, high blood pressure. If they're not able to lose weight with the help of diet and exercise, then they should start thinking of bariatric surgery earlier than later, because if they're not diabetic yet, they will not become diabetic. So yes, they should start thinking of taking the help of surgery at an earlier stage. The good news is that the surgery is very standardized. It is almost always done laparoscopically with small cuts, 2 to 3 days of total hospitalization. So the complications of surgery are actually very rare, less than 1%. But yes, some things that we would be concerned about is risk of bleeding or risk of leak from the gastric staple line. So we are very careful. We do a check during the surgery, and the day after surgery in every patient we do a CT scan with a contrast eye. We check everything. But yes, the complications of surgery are very unusual, quite rare with the standardization of surgery. Yes, it is possible to regain weight after the surgery, although it's usually only a portion of the lost weight. Most patients are able to maintain most of the weight loss, but yes, about 20% patients, 1 in 5 patients can regain some of the weight they lose, and the reason for that usually is not being so compliant with diet, not following a correct diet, or not doing any exercise. But for the most part, if patients are following a good, healthy, high protein, low carbohydrate diet, doing just 30 to 40 minutes of maintenance exercise daily, then they should be able to maintain almost all of the weight that they have lost. There are now studies 10-15 years later after the surgery, and 80% patients are able to maintain most of the weight loss. So yes, the stomach does stretch some after the surgery, but it will never go back to the initial size. It may, let's say somebody had a stomach diameter of 12 centimeter and we reduce the diameter down to, let's say, 3 centimeter. It may stretch to 4 or 5 centimeter, but it will not go back to the previous size before the surgery. So yes, the diet does increase, let's say 2 to 3 years after the surgery. There is a slight increase in the diet as the stomach does stretch. During the surgery, we are very careful that we have to remove the fundus of the stomach, which is the most stretchable part of the stomach. So we have to be careful to completely remove the stretchable parts of the stomach, so it does not stretch much, but to a very limited extent. So it's very important after the surgery to, what I tell my patients is that surgery is for your overall good health. So you should always exercise, you should follow good diet, and you should avoid smoking, alcohol. Smoking you should try and avoid completely. Alcohol, in moderation, maybe once in a couple of weeks, but yeah, daily alcohol intake, snacking, those are some things that should be avoided after the surgery for overall good health and the best results from surgery. So the best things to eat after surgery, or even without surgery, somebody who wants to lose weight, is a general recommendation, is the same thing. The surgery only help you follow that diet. You should take a high protein, high fruit, fiber diet, and avoid processed foods, things that you buy from outside in packets. Processed foods are best avoided. You should avoid eating out from outside more than once a week, and generally follow a good high protein diet. Yes, so it is a normal diet that somebody needs to follow. It is not a special diet. For the most part, I tell my patients that in your diet you should try to take 2 sources of protein in every meal. So you take breakfast, you take lunch, you take dinner. In every main meal, try to take 2 good sources of protein, and in between the meals you take 2 snacks. But whatever you eat should be healthy. You should avoid processed foods, you should avoid carbohydrates, make healthy choices. But it is not a special diet. It is a good, it is just the same diet that you need to follow to lose weight anyway if you were 30 to 40 kg excess weight.